All right, so moving to our next presenter, um, let's welcome Dr. Anat Hassner, Chief People and Strategy Officer of Uniting. Dr. Anat will present a case study on transforming the employee experience in a workforce crisis. Dr. Anat joined Uniting in July 2022, following multiple Chief People Officer roles in the private and public sector. Dr. Anat has also had a significant career in change and transformation, including leading organizational transformation for Woolworths, Meat Company, and significantly improving their bottom line. Let's all welcome Dr. Anat Hassner.
Thank you. I love how you keep referring to me as Dr. Anat Hassner. That's great. Gives me a bit of a boost. Hi, everyone, and nice to see you all today. Who here is from HR, in the HR space? Oh, okay, I'm with my people, people. So that's good to know. I'm going to talk to you a little bit about the transformation that Uniting had recently undergone, and it speaks a lot to the stuff that you just spoke about, Warwick. So, you know, hopefully there's some dots that we can connect, and I always put this offer out. It never gets accepted, but still, if you feel like asking a question along the way, or if you feel like interacting, I'm very open to that. So Uniting, who knows a little bit about Uniting? Few of you, not many of you. Yep. Uniting is a very large, one of the largest not-for-profits in Australia. We have 11,000 frontline workers, 11,000 workers, and we look after two primary areas. We look after aged care and communities. In the communities space, we have youth, unemployment, disability, homelessness, and early learning. And in aged care, we have home and community care, we have residential aged care, and we have villages. We have the independent living villages. So that makes up the bulk of our workforce, the aged care sector of our organization. That's about 7,000 people that are part of the aged care part of the organization. I joined Uniting 2 years ago. Almost exactly 2 years ago. And when I joined Uniting, I had a conversation with my boss, the CEO, Tracy Burton, who by chance is also speaking like right next door. So we're going to compare notes after this. And I asked her, like, what does success look like for me? What would you like me to achieve? And she said, we need to transform Uniting. And I said, great, because I love transformation. What are we transforming to? She said, I'm not sure, but we know we need to transform. So that was challenge number one, is just trying to understand what we're trying to do here. So I went straight to data because I'm a little bit data obsessed. And I really believe in the power of data to achieve organizational outcomes, especially when it comes to really huge organizations like Uniting. You can't go and count things or look at things. You're talking about 500 different services that are spread across New South Wales and ACT. It's really hard to actually see what is happening day in, day out in these services. So for me, that comes down to data. And I asked the team, I started with recruitment, and I asked the team to show me what the recruitment data looks like and what the workforce data looks like. So right off the bat, we did not have any data. So that was red flag number one. And then when we did start to pull together some data using PageUp, we found out that the amount of vacancies that we have, especially in aged care, through the workforce crisis that was so prominent last year, we had vacancies of around about 10%. So 10% of the organization was vacant. So if you think about it, this is not turnover, this is actual vacancies, actual roles that are unmanned. So if you think about it, if you have an organization of about 10,000 people, that is 1,000 people that are not in roles. And if you think about I don't know, 70 aged care facilities, that is a lot of people that aren't helping people in need and people that need care. So I said to Tracy, and I spoke to the person, the CEO of that area of the business, of our aged care business. I said, should we not try and address this problem like it's a crisis? Because it feels to me like a crisis. And they said, well, is crisis too extreme? And I'm like, is it not extreme? Do you not think that the situation we have at the moment is extreme? So, of course, they all agreed that it's a crisis, and everyone kind of thought, you know, we've been a frog in boiling water. This has just kind of crept up on us, and it's become really significant. And because we are so data poor, we haven't really looked at the situation that we ended up in. So I said, okay, well, let's set up a crisis response. We know what that looks like because we just came out of COVID. We know what crisis response looks like. Let's take the learnings from COVID and apply a crisis response to our workforce problem, which we did. And the first thing we did was look at how many applicants are we getting and how many applicants are we landing into the organization, which immediately highlighted that we are doing a pathetic job in recruitment. Absolutely pathetic. We were getting 3,000 applicants per month, and we are turning around about 10. Those were the numbers we were facing when we started this close to a year and a half ago. And so I spoke to the man in charge of aging, and I said, does this not feel like there's an opportunity here to solve the problem just by doing better recruitment? And so we started setting up a bit of a method for how to do this, because it's not like fixing this hadn't been attempted before. It had been attempted. But the way in which it had been attempted is a bit like shooting at all direction. Like try a little bit of this, try a little bit of international, try a little bit here, rather than a really methodical end-to-end value chain approach that starts with the candidate right at the start. What are we doing wrong with the candidate? And that opens up like a flow of candidates in. And then you go, okay, what is happening in the interview phase that is stopping candidates? So we worked on that, and that opened up the flow again. And then we go to, well, what's happening in the compliance space? Because that's where they really get stuck. And then what's happening at the contract space? And then what's happening at the application sign-on space? So we started looking end to end across these value chain steps, and really methodically, every time we unblocked a process, we went to the next process, part of the process, to unblock that part. At this point, the board said to me, look, you're really pushing the recruitment angle, which is great, but we have a real problem with retention. What are you doing about retention? And so I said, do you mind just maybe not going to retention until we have the people on the shop floor providing care? Like, actually, until we solve the recruitment problem, there's no point even looking at retention. So they took that and they were okay with that. They backed up from retention a little bit, and we spent a good year looking at those processes in recruitment. And I'm really, really pleased to be able to say that we have made a significant difference in our recruitment practices, to the point where month on month this year, we have hired an average of 50 nurses into our organization. Who here has heard about a little nurse shortage? So it is possible. And I think to your point, the workforce exists. It's just a matter of how you bring them on, how you train them. We did a lot of work into the onboarding and training as well. So for example, we know that in order to have a carer work in a residential aged care facility, they need to have about 3 months of education over a 12-month period. We took that 3-month education requirement and we shortened it to 3 days. So we called that process Quick Start, and I'm really happy to share whatever information we have developed in Uniting with anyone here. So anyone who's interested, feel free to reach out to me, and I'm keen to give away as much knowledge and capability as we can. We're a not-for-profit, we're not trying to compete with anyone, and we want everyone to win together. So we fixed recruitment, we fixed onboarding, we found more workforce. Of course, the wage increase didn't hurt us, but the wage increase didn't make a difference to retention. So we still saw high levels of turnover that were concerning. And at that point, when the recruitment piece was really embedded, and we can see that actually wherever we want to fill roles, we are filling roles. There's a couple of really tricky ones like Ganelaba near Lismore, but other than that, we are really getting people in the door and at the front line. So we now have services that are manned or womaned, and people are working with residents, and people are feeling like they don't have to do double shifts and triple shifts, and they don't have to really harm themselves through the process of giving care. And so now it's a question of, what do we do about retention and our culture? So we started thinking about retention, and we thought, right, well, if we have the people, what is going to drive retention? Why are people leaving us? And we had a lot of feedback about why people are leaving us, and this was a lot trickier. We found the retention conversation a lot trickier because even though we had a ton of exit interview surveys telling us, you know, people are leaving because of job shock, or people are leaving because they don't feel like they get paid enough and they can get paid more elsewhere, or they just thought they tried the care sector, but actually it's not for them. Lots of different reasons that were really hard to address in any sort of methodical way. When I joined Uniting, one of the things that I was really passionate about is to improve the way we do case management. Who here does case management? Case management as in grievances, issue resolution, misconducts. That's what we call case management in Uniting, the people cases. And we work together with the team to really make a difference in the way in which we address cases. To me, one of the most important aspects of working with people is working with people that you can either relate to or like or communicate with or tolerate even. But if you have a service and that service has approximately 100 or 200 people, and some of the people in that service are really toxic and really hard to work with, that's going to not make you want to stay. And you're going to go to a different organization that gives you exactly the same salary and conditions, but the people there aren't as awful. So case management became a real area for us to focus on. And what we've seen is that as we improved case management, not only did the cases go up significantly, so when we started this, we had 50 cases. Today, we have about 200 cases that are on a monthly cycle. It's gone up significantly, but also we can see the almost direct correlation between solving people cases and retention. There is almost a direct correlation for it. I am pleased to say that when we started this journey, we were at 30% turnover in residential aged care. Today, we are at 14% turnover. And I would challenge anyone to show a 14% turnover anywhere at this point. It is a very hard number to achieve. So I'm extremely proud of that number. And I do think that the very obvious change is what we did to improve the relationships between the employees. That also drives retention, but it also drives culture. But what else drives culture? What is the number one thing that you think drives great culture? Purpose. What's the number one, the most important thing to drive culture? Who said leadership? Leadership. If you've got leaders that are walking the walk and talking the talk, that drives culture. At the end of the day, you can have, organizations with the best intentions on the planet, but if the leaders aren't demonstrating that day in, day out, and really holding people to account for the type of culture that they want, none of that matters. Now, who here, many of you are in HR, who here has impact over leaders? Good. You have impact over how your leaders show up. And so you have a huge amount of impact over the type of culture that your organization has. And what we did in Uniting, on top of really solving cases, and when we solved cases, it wasn't just, moving out employees that were not behaving in the way that we wanted. It was also having these conversations with leaders and potentially asking certain leaders to leave when they didn't demonstrate the kind of culture that we wanted or the kind of behaviors that they wanted. So one of the things that we did is we started looking at the 9-box. And I feel a bit naff telling a bunch of HR people about the 9-box. But the reality is that for us, it worked really well. I was able to sit with my CEO and go through some of the leaders in her team. And the team below then spent some time going through the leaders in their team. And the team below then spent some time going through their teams. And when you have such a steep hierarchy, that process that starts from the top and people can see changes in leadership as a result of these conversations, it makes a difference to the culture. And we absolutely saw that certain leaders even chose to leave as a result of that process. So that started to also change the culture. It's really hard, as you all know, to measure culture. But what we can see is that our retention rates are solid. And that to me is one of the absolute key indications for culture, as well as, believe it or not, the increase in cases, because that tells me that people trust the process. And they trust that if they share with us their concerns, we will listen and we will do something about it. So those are the key things that we've done over the past year, but there's probably one other significant thing that I'd like to share with you. So I said that when I joined Uniting, there was a real absence of data. And as the intro had stated, I've come from large corporates and governments, and my expectation is that there are systems and you can pull data out of systems. And so I was pretty surprised for an organization this big that there isn't, for example, an establishment or core HR or systems that allow you to see your people. What we did have is a payroll system. And what we had in the payroll system is a payroll system that is pretending also to be a core HR system. So it was loaded with information, with employee information. You know exactly what I'm talking about. It was loaded with employee information. And we have a fortnightly payroll run. And every fortnight, my team used to go, right, we're about to run payroll, so everyone cross your fingers, close your eyes, and hope to God it doesn't explode. And that didn't feel to me like the right way to run a payroll system. So we got onto the journey of looking at a ERP or a HRIS. Who here has a pretty new, shiny ERP or HRIS? So some of you have gone through the pain of that implementation and through the horribleness of the change management aspect. We are well and truly in that, but I had to do a pretty significant sell job, not just on my CEO and my peers who had to all lean into this, but also to the board. Like, why do you need a HRIS if we already have a payroll system and it's working largely, generally? So 2 things that I really focused on. The first thing is obviously the risk. Luckily, our system is sunsetting in 2026, so I can say, you know, the payroll system is phasing out, so we have to change it over, and the earlier the better. But also compliance risk and the risk of multiple systems. If you have a payroll system that's not talking to your rostering system, and you have a large workforce, a large varied workforce, you guys know what I'm talking about. You are in trouble. You are in trouble because you have to manually understand the variances between the contracts that you've given your workforce and the way in which you are paying your workforce. And also, where is your EA? Where are your EAs sitting? If they're sitting on your rosters, they're not necessarily aligning to your payroll. So all these challenges and questions have emerged through this process. And what we know for sure is that the swivel chair of having a whole bunch of people sit and work on the payroll system and then swivel around to work on the rostering system isn't really a good way to run payroll. And payroll is obviously highly risky, and so that concept of risk was compelling to the board. The second area that I flagged with the board is the future of the employee experience. So what we did is we created 2 frontline workers. We called them Sarah and Jeremy. And these 2 frontline workers were brought to the board almost 2 years ago. So in the October board, I'm about to do that again. 2 years ago, I brought the Sarah and Jeremy to the board. And I said, here are 2 frontline workers. And here is their experience in uniting at the moment, because we have all these systems and all these processes and everything is everywhere. And so guess what? When they need to take leave, what is the likelihood of them really connecting the dots into the systems for which they need to input their leave in? What is the likelihood of them using our benefits system? What is the likelihood of them using our training systems? All these systems are separate. What is the likelihood of them using our pay systems and really understanding where to go, where to look for their pay slips? It's unlikely. It's more likely that they're doing everything to avoid going into these multiple systems. So how do we create an experience for them that makes it easy for them? And I'm going to share something with you that we have used quite a lot. I said to them, can we focus on our front line holding a hand and not a pen? And so that was very compelling. I gave the story of Sarah and Jeremy back in 2022, and I had each one of them recorded. They're not real people, but I made them up and recorded their experience in 2022. And then I said, fast forward to 2025, after we've implemented this HRIS that I'm asking for a lot of money to do. Fast forward to then, Sarah and Jeremy's experience is very, very, very different. But guess what is the number one most important thing that we are going to do for their experience? We are going to look after their career paths. We are going to help them grow with Uniting. And we are going to understand them because we will see where they came from in Uniting. So we won't just focus on where they're going. We'll also focus on where they've been. We'll understand their skills and we'll build them towards their dream job. And so that also compelled the board. So we're currently in the process of implementing Dayforce. We are going live. I couldn't see that, I'm sorry. Is that 2 minutes? Okay. You were trying to be inconspicuous and I just outed you. We are in the process of going live in April next year, and we are going big bang. So if you can think about aged care workers and community workers and case managers, they are all going to have to move from having no access or no phone-related, work-related engagement to completely being on the phone with all things to do with Uniting. So that change, even just using the phone, that change is a massive cultural change that's going to happen for us. And needless to say, I am losing a lot of sleep over this, but I'm also really excited about how we're going to impact our frontline workers and how we're going to look after them and change their experience in Uniting. So that's it for me. Thank you.
Thank you, Anat. Do we have any questions for Anat before we wrap up?
Hi, Annette. Great information. It's good that looking at people and strategy officers sharing directly what they are doing in the organization. We are not as big as Uniting. I'm CEO from Multicultural Care. You challenged that the rate of 14% is hard to achieve. So I'm proud to share our turnover rate is between 10 to 12%
That's
after
amazing.
after COVID-19. Yes, we have put so many things as well, like EVP and other things as well.
That is amazing.
Yeah.
Congratulations.
Yeah, thanks for that. And yes, it's hard to achieve. You have to put a lot of efforts into that. So I'm proud of my HR team that they have achieved it. So just want to, because changing systems, especially technology, and when it is impacting the big asset of the organization like people, it's very hard. So I was just wondering, do you have any tips? You are implementing Dayforce. So you have any tips? How did you bring them along while implementing this new system?
How did I bring frontline people?
Yeah.
So that is in April next year. We're going live. So we haven't gone live yet. But what we're doing is we're putting 80% of our effort across the executive team on the change management piece. So everyone's really leaning into change management. The first thing we're doing is understanding our change management risks. So imagining where we're going to have problems. Who is going to not like this? And for what reason? So for example, we have an area in Uniting that has never done digital time and attendance. So we know that that's going to be a cultural shift for them. They've never had to be transparent about the time that they're putting in to their work. So that's going to be an area of risk. So we're just thinking through those areas of risk. And then we're thinking about, right, how do we engage this team from their leader all the way down to the frontline worker, to make sure all of them can really move with us. That's not to say that we won't have resistance. I can guarantee we'll have resistance. And in fact, one of the things that I've been doing is avoiding selling it. So I'm really careful every time someone says, oh my God, it's going to be so good when it happens. I'm like, no, it's not. It's going to be horrible. It's actually going to be horrible for the first 6 months. And unless you get it through your head that it's going to be horrible, this is going to be even more horrible. So that kind of management of expectations and making sure people are with me when it's really hard is also very important.
Great tip. Thank you.
We can have one more question if there's.
I'll also call you Dr. Anat.
Thank you.
I won't say which organization I work for because I just started 6 months ago. I don't want to be booted tomorrow. But the quick question for me is, orientation and induction seems to be a major Achilles for most providers. And in fact, a lot of staff leave in that period of between
Totally.
2 to 6 weeks, and therefore impacting retention. Did you do any work in that except for onboarding?
Yes, we did one thing in particular that was really helpful, and that's, first of all, the data. The data, that's really important. But also we did a day one survey. In that day one survey, we asked 3 questions. We asked, has your manager greeted you? i.e., do you know who your manager is? Have you received your uniform? And do you know what your roster is? And if we believe these 3 questions are answered yes, we can see that there's a higher potential for success in this role, because that's how you want, on the first day, manager greeting, the belonging with the uniting shirt, and you want them to know what hours they're working, because guess what? Who here would start a job without knowing what their hours are going to be? And so we know that these are significant drivers for retention early on, and that's what we're asking. And the areas where the answers are no, those are the areas that we're going into.
Hello. Cut me off. Just no, we didn't. No, I did not cut you off. It's the audio. Sorry, you may continue with what you're saying. We didn't.
That's one example, obviously. There are other examples, but that's a powerful one.
All right, so I think that's the wrap up of Dr. Anat's presentation. That's very insightful session. And can you join me in thanking Dr. Anat? Round of applause.